I'm Becca. I'm trying to learn medicine. Today, Anorexia Nervosa, and after we've done it, we're gonna do a bit standing yoga. And if you participate in the standing yoga, then it's better at your own risk. We're talking about disorder and also psychological disorder and eating disorder and about internal anatomy. And this is no medical advice, we're just reading about it. Anorexia nervosa, a disorder in which the individual refuses food because of an unnatural fear of putting on weight. It mainly affects adolescent girls in affluent Western communities, although occasionally older married women may be affected. One patient in 15 is male. And the book is from the 80s, so maybe some things have also changed. But what I say so far is that it is where a person in 14 out of 15 women have an unnatural big fear of putting on weight. Anorexia nervosa is becoming increasingly common. A recent survey in Scotland showed that 3 people in 200,000 suffer from it. And again, so in the 80s there was a survey in Scotland and it was 3 in 200,000. The condition is distressing for the sufferer's family and friends because they cannot understand her or his subconscious self-deception regarding the need for food. The sufferer convinces herself or himself that she or he is too fat, that she or he has not lost weight, and that she or he does not need either treatment nor food. Okay, we're saying here that it is also burden for the family and the friends, at least it doesn't affect them, to see that the other person, and they cannot understand that the other person does not want to eat, and that the other person oftentimes does not see that they have lost weight, and oftentimes also does not see that the person maybe needs treatment. She or he is unlikely to listen to advice from family or friends about the need for food. So they should be prepared to seek medical help on the patient's behalf. Treatment is essential, and although most cases recover, occasional fatalities do occur. Okay, they're saying that many people who have it do not only see that they are not overweight, but that they're also not seeing that they're getting too lean, and don't understand that they need medical help. At least some. Symptoms. Failure to eat for long periods. Okay, the person has for a long time problems to eat. Loss of weight is a symptom. The person loses weight. This may be considerable and obvious to everyone except the sufferer. Okay, the person loses weight, and a lot of it. And most people see that, but they say the sufferer, but oftentimes the person who has the anorexia does not notice. Vomiting occurs. The patients, so this is an overview now overall, probably, over different types of anorexia. Vomiting occurs. The patient's changed attitude towards food leads to vomiting, being self-induced, and I want to stress at that point very strongly, this is a book from the 80s. Maybe that book is a bit outdated on this thing. Vomiting occurs. The patient's changed attitude towards food leads to vomiting, being self-induced, often concealed by the patient. The person doesn't want to put on weight, so the person is vomiting what they have, what they try to eat again out, so that cannot be processed, and it actually cannot be used to keep the person alive and to get energy from it, because the person fears that it would be stored as adipose tissue. But in these cases it is just used for energy and not stored. And also the next thing is that the menstrual periods stop, and also in males the sexual desire is lost. Reluctance to undress in front of others, probably because of a subconscious desire to conceal weight loss. Weight loss. I skipped a little bit about the text, and therefore the word the other way around, that the person thinks they are too obese. Okay, we're saying it the other way around, but it is interesting. We're saying that the person wants to conceal their weight loss, but that would mean that the person sees that they had lost weight, and all what we written in the beginning would be the other way around. Whatever. It can be that the person has a strong reluctance to undress in front when other people are around. Duration from a few months to 3 or 4 years. We're saying over a few months or also a few years can it take. Causes. The causes are uncertain, but the condition has many features of phobias and compulsive obsessive behavior. And again, at that point, that is from the 80s, that seems to be a little written here, but we're having 2 points more. Disturbances in the causes. Disturbance in secretion of sex hormones may occur. How's that the cause? I don't understand it. Next thing, strained family relationships and emotional upsets are extremely common, but it is often not clear if these have preceded or followed the onset of symptoms. I think this is pretty broad written, maybe about many different types of anorexia. So we're saying also a difficult relationship with people around them, or that the people around them have a difficult life, basically. Complications. Severe loss of weight is a complication. It's an anemia, that is, we have it, that is that there are not enough blood carrying hemoglobin cells, and there's not enough oxygen transported through the body. Infertility and loss of sexual desire are common. Very occasional death can occur. Treatment in the home. None is advised until medical advice has been sought. It's interesting, because it would make it worse, because the people do not know how to read. But hopefully the people know a bit more than written in this book. When to consult the doctor, as soon as the condition is suspected, so that it doesn't manifest itself, is my guess. What the doctor might do, get the sufferer to accept the need for medical help. This is usually the first and most difficult step in the treatment. Okay, we're trying maybe to talk about the anatomical things and talking about how adipose tissue works and how the body gets energy for food, what is used to live, to breathe, to keep the heart pumping, to keep the hemoglobin cells alive, what the body needs to live, and what would be stored as adipose tissue. Maybe we're talking just about what is happening there, and maybe that would be already enough if the person knows how the whole circle of eating and using the energy of the food and possibly of it storing it as adipose tissue would work. Confirm the diagnosis, so we're checking if it is. Refer the sufferer to a psychiatrist if she or he is willing to go. Often she or he will accept treatment only from her family doctor. Okay, they are saying that there is maybe the optional help for a person who knows more about psychology. Agree a target weight to be achieved with the patient. So we're talking when, and again this is from the 80s, but seems to be just one singular idea for a method. I'm pretty sure there are people who thought about hundreds of things which could be possible to talk about it. So we're saying one idea how to talk about it would be when to set a target weight to be achieved by the patient, but I don't like to give medical advice. I don't like to talk without knowing anything, but get proper advice. Maybe that is the way. Maybe it works. I don't know. Maybe there's a statistic in that actually works. Ensure, if necessary, by admission to hospital that food is being eaten. So it can be that the person strictly refuses to eat the food and does not eat the food because we don't want to eat it. And then it can be that they are admission to hospital because they're getting too lean and starting to starve and to die. But it is when looked that they have actually eaten the food. That food is being eaten, that vomiting is not concealed or being self-induced in private, and that the weight target is being achieved. So they're looking then with the person, if a person is vomiting, and if a person maybe induces it himself to vomit, and they are also looking at the goal set of a bit of weight gain, a healthy weight gain is achieved. Prevention, none is known here written. Outlook, in about 80% of cases, response to treatment is good. About 20% are unaffected by treatment and the symptoms may continue for several years. So we're saying, with these things said here, with these things, we're talking about what it is, that it is actually a weight loss which is getting dangerous, and when maybe talking about how the person can gain again a healthy amount of weight. In 80% of cases it works, so we say here. In 20% of cases at that time here, they hadn't had the proper solution. And it could then continue for years if the person suffers from it or has it. Now that was the medical part. If you were here for medicine, you can go to, and again, this was no medical advice, I just did it from that book. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the standing yoga, a bit standing yoga, short standing yoga, then you sit at your desk. Now we're having the feet standing together and we're breathing in and lifting the arms. And breathe out the arms again down. In and the arms up. And out and down. In and up. Then out and out to the side. Again in and up. And out to the other side. In and up. Make an inch space between the feet and out again to the side. In and up. And now sink down. Breathe in, come up. And breathe out onto the side. In and up. Out the hands over the sides down, lean onto the knees. Breathe again in. And out and make a head with the back. Again in. And out, make a belly with the back. Again in. And out a head with the back. In into the middle. And out the belly with the back. Again in into the middle. And out come with the long back up. And make it to the top and backward shoulder. And the next exercise. Have a leg standing back, that's it. Breathe in, lift the arms up. Breathe out, up to the side. In and up. And out, bring the arms over the sides down. And go down into the chair. Breathe in, come halfway up. Come higher up. And out and come up again. Breathe in, reach high. And out to the other side. Breathe in, lift the arms up. And out, bring the arms over the sides down. Breathe in, come halfway up. High up and out and up again. Breathe in, reach high, come up onto tiptoes. And breathe out and sink down. This can go onto the knees. Breathe again in. And out and up. In and down. And out and up. And the arms over the sides down, the feet again together. And then down. Breathe in, bend the right leg. And breathe out and stretch your left leg. In and change. And out and stretch your right leg. In and change. Out and stretch your right leg. In and change. Out and stretch your right leg. In into the middle. And out just down. Now breathe in and lift the right hand up to the sky. Breathe out with the left leg, left knee. And look over the right shoulder to the right hand. Breathe in, hand again down. Out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left. Inhale again down. Out and down. Breathe in. And breathe out and come slowly with your round back up again and make it to the top of the backward shoulder roll. Breathe in, lift the arms up. Over across the arms and intertwine the fingers. Reach high and breathe in. And breathe out, reach in front and hold up the back. In and up. Up across the other way around. Breathe in, reach high. Breathe out, reach in front, hold up the back. In and up. Now lean with long arms back. In and up. And now draw the shoulder blades together. The arms up and go down. In and up. Now lean with long arms back. In and up. And out the arms down. Breathe in, lift the arms up. And out and down. In and the arms up. Bring the hands to touch and lower hands down to heart center. Weight loss and standing yoga. I thank you very much and until next time.